It's a great day to talk rehab. I'm Dr. Donald DeFabio, and today it is all about knee pain. You know, so many people are exercising at home right now, and what's a good home exercise that people like to do for their legs?
Squats and lunges.
Yeah, squats and lunges, exactly. However, if you do them with poor technique, you end up getting a lot of knee pain. So today we want to talk about, number one, what to look for in your technique to make sure that your squats and lunges are done properly, and number two, how to fix it. So first of all, Allie, thanks for coming out today. Say hi to everybody.
Hey guys.
Yeah, so let's look at the squat first. So just take a normal squat stance for me and do it perfect. Now if you notice, come on up, how the knee, go ahead, squat again please, Allie, how the knee tracks over the toes, okay? Come on up. What frequently happens, this time let it go into valgus. As she squats, you see how the knees go in? Bad news, okay? Come on up. What happens, one more time, let the knees go in, that will cause a lot of irritation to the kneecap because the kneecap isn't tracking in its normal groove. So when you are doing your squats, keep your knees over your toes. Let's face that way for a second. You also want to maintain what's called that sagittal plane alignment, okay? So you want to keep everything where the ear is over the shoulder, shoulders over the hip, hips over the foot. Turn back towards the camera. So we want to make sure everything stays in that alignment. Positioning for the squats, shoulder width apart is good. You don't need to come out, bring your foot out here. You don't need to come way out there for your squats. That's not anatomical neutral. It might give you more power, but it's not anatomical neutral. Where we live is with our feet underneath our hips. That's how you get in and out of a car, in and out of a chair, and it's a functional range of movement. The joint's called centrated. You're getting optimal muscle movement. Turn towards me for a second. So we make sure we have that optimal sagittal plane line, and give me a little bit of a squat. And you see how her knee stays behind the toes? Excellent. That's also very important. Show us what we commonly see. Knees driving forward, hips not going back. Prescription for disaster, all right? You want to maintain that knee over your first and second toes when you go forward, and you don't want it to go past the foot. When you squat, let's get a good hip drive. See how the hips go back? That's the key. You got to get the hips back. The same concepts apply for lunges. Let's do a small little forward lunge. Right? See how the knee stays over the foot? Good hip mechanics, and come up. What you want to avoid, let the knee come forward, is that, all right? That's going to bang up your knee. That patella, the kneecap is going to track too much tension, and it might go medial, it might rub on the inside, it might go on the outside, it's going to create a problem. So there's a real simple fix for these, all right? When you squat, when you lunge, we really want to engage your glutes, all right? And the other reason we want to engage your glutes is because when you sit all day, passively, those shut down, all right? So we want to wake them up. So what we're going to do is we're going to take a CLX band, a continuous loop band, so it's an elastic resistance with these continuous loops. Let's put that on. While Allie's putting that on, I want to also mention to you one other really good exercise for knee pain. You can go, it's from Tai Chi, all right? Horse stance. Just feet, now your feet are a little bit wider, all right? Tai Chi. Don't ask me why, karate. You go into that horse stance, power stance, but the butt's back, all right? That's something else you can do. Hold it. Research has shown that people hold that for 30 minutes a day. You can't do it 30 minutes straight, but throughout the day. So we took the CLX mechanism and we put it just over the knees. So now when Allie squats, let's say her normal squat, she has a tendency to go in, right? So now when you squat, she's going to be pushing out against the band. So that's going to keep the knees over the feet, and it's going to strengthen all those muscles and re-pattern that abnormal movement. Face it towards me. When you're on the desk, what happens to your upper back? You get all hunched over. Your head goes like that. So we want to fix that too. We can do them both with the CLX, the way it's hooked up. So you put your hands in the top loops, crisscross them. I'm going to give you a little more room. Now, you're going to squat and then open up into a full burger's position. So squat and then open up, and look at that. She's getting engagement of the whole posterior chain. She's keeping the feet over the knees. She's not getting that valgus, that knock-knee effect. Opening the chest, strengthening the back, okay? Turn towards me. You got enough room? There you go. And go ahead. So she's opening up, good hip drive. Bring the knees back just a smidge. There you go. And come up. See, with the increased power this way, you want to drive forward. So you have to balance that, all right? It's all about balance. So these are simple things you can do at home to get good squat mechanics so you can work your legs and not get hurt. So you can get a nice workout. Make sure you're engaging the glutes. That hip drive is really important. So, Allie, thanks for your time today. It's been a great day to talk rehab and knee pain, simple things that you can do at home. I'm Dr. Donald Fabio.